Good afternoon, and thank you for joining us for the daily Riley County Coronavirus Response Update. Today is Saturday, May 2nd. I always have to look at the date. And my name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan. And with us today to provide some information, we have Local Health Officer Julie Gibbs, Kurt Muldrup, who is the Assistant Director of the Riley County Police Department. And then providing ASL interpretation services, we have Tony Kroll. So thank you all for joining us today. We don't typically do a weekend broadcast, but since the local health order number 7 was issued just yesterday, and we have businesses reopening in Riley County on Monday, we wanted to check in and provide you a little bit more information about that. Julie has a statement to share to start us off.
All right, thanks, Vivian. Hi, everyone. As of today, May 2nd, Kansas has 4,746 positives. That represents a 297 increase from yesterday. There are also 541 hospitalizations and 131 deaths statewide. Here in Riley County, we have 52 confirmed positives, with 29 of those considered recovered. The newest positive patient is a 23-year-old female who is currently isolating at home. We have 49 pending tests here in the county, and so far we've had 480 negative tests. We have worked hard on putting together a very detailed and thought out order in which we determined restricted movement was the most appropriate title. This is no longer a stay-at-home order, but our message is very similar. Please limit your movement and get out only when necessary. We need to stimulate our economy, but we also need to stay vigilant as the risk is still great. Social distancing should still be a term we use every day. We won't see the effects of opening more businesses for another 14 days, so please continue to stay the course. If you have any questions or concerns, please don't hesitate to reach out to us at rileycountycovid19@gmail.com. If you have symptoms, please call our screening line at 785-323-6400. We do have healthcare professionals answering those calls daily, even on the weekends, from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. If you would like to pick up masks or donate masks, please visit Westview Community Church at 615 Gillespie Drive. You can do so anytime from 11 to 3 on Mondays, Wednesdays, or Fridays, and again on Saturdays from 9 to noon. Please know that we are working hard to keep you informed and safe. We will always let you know as soon as we can when there is new information. Thank you.
Thank you so much for that update, Julie. And I know that you spent a lot of long hours doing research and talking with community partners and members of the EOC about what needed to be included in the local health order that takes effect on Monday. Again, this is in response to the governor allowing her statewide stay-home order to expire. And I know the Riley County order has a couple of differences in terms of requirements and what's allowed to reopen when compared to the governor's order. Can either of you talk a little bit about why those differences were important for Riley County?
Yeah, so we have to keep in mind that the governor has to consider the whole state of Kansas, and it looks very different depending on which county you're living in. And I'll take Western Kansas for example, since that's originally where I'm from. Scott County, Kansas only has 1 positive. So their situation is much different from our situation here in Riley County. So that's one thing that people need to remember. The governor had to make an order based on the whole state. And she even said in her address on Thursday night that she did expect local health officers to make some changes, and they could be a little bit more restrictive. We've seen some counties going ahead with the stay-at-home order, implementing a stay-at-home order, depending on, that depends on their situation. We didn't think that was necessary, but we did think that there needed to be some restrictions, and that is why we've put some restrictions in place. I think you also need to consider our population here. It's a very transient population. We do have a lot of individuals who live in Pottawatomie County or Geary County, Morris County that will work in Riley County. We're kind of the hub for the region, and that can be said for a hospital as well. It is the hub. And so in looking out for our hospital and the capacity there, we need to be aware of that and put in certain restrictions. So that is why we decided to be a little stricter than what the governor has put forth.
I just want to remind folks who are watching on Facebook Live that if you have questions for the group, you can leave those in the comments. I'll be checking throughout the broadcast and asking those questions when I can. If we don't have a chance to address your question during the update, we'll go back in and answer those via text afterwards. So please let us know if you have questions. Back to the details of the order that takes effect on Monday. We have some requirements for restaurants and also some best safety practices in place for businesses. Can you talk about why, in particular, we decided to limit restaurant capacity, the dine-in seating, to 50% of occupancy and have required that to close down at 10 p.m. every night?
Yeah, so again, we wanted to be a little stricter because of our situation here in Riley County. We have not peaked yet. We're a little behind the state in that way. We have not stabilized yet. And so we need to be aware of that. We went back and forth on this decision. It was not taken lightly. We did get a lot of input from our two task force that we refer to a lot, our clinical task force and the recovery task force. We also based this decision on guidelines that we see, Johns Hopkins guidelines, as well as the White House guidelines, which both say that you should look at your numbers as far as stabilizing or a downward trend in numbers before you start reopening. So we know we have to stimulate the economy. We cannot keep it where it is right now. And so we take that into consideration as well. It was a very hard decision, but we worked with our partners, Geary County and Pottawatomie County, to come up with a compromise. And that is where we came up with the 50% capacity. I know it is the same in Pottawatomie County. So we wanted to compromise on this. We want to open up businesses, but we want to do so in a controlled manner. The 10 p.m., we've gotten a lot of questions on that. That is simply to distinguish between a restaurant and a bar. As you know from the governor's order, bars cannot be open. So we do have language in our order that describes what a restaurant is, and to be considered a restaurant, you have to fit this certain description. But we wanted to further distinguish. We know that a lot of kitchens and restaurants close at either 9 or 10 o'clock. So we went with a later time to give them a little bit longer, but we don't want people lingering around past that. They can go out to eat, but not necessarily, we don't want them lingering longer than that. That will greatly increase the risk of exposure.
And Vivian, this was something that the Recovery Task Force looked at with us, and we had input from the restaurant owners, and we had actually thought about either closing earlier or reducing the capacity inside. And based on their input, they said it needed to be at least 50%. If it was less than that, it just wasn't worth opening because of their costs. And so I say that just because I want to show our desire to work with the businesses, to work with the community, to find out what's best. Another thing we heard from them was it was critical that they got their employees employed, stay employed by June 30th. And our goal here is that we slow and steady, that we may move forward in a measured way so we don't set back. And then that moves all the timelines back in our phases, which could put that in jeopardy. And that June 30th is important because of the loans that they got from the government that have to be paid back. People have to be employed. I don't know all the details for that, but they emphasize the importance of being able to keep everyone employed through June 30th. So it's important. I say all this because I want the public and the businesses to know we listened to that task force as much as we could in the short time we had from when the governor's order came out to when we had to put ours. And it's also important, I think, just in restaurants, that's where you're sitting down and going to spend a sustained amount of time together in smaller groups with other groups in the restaurant. And restaurants don't all have negative flow air, so you're going to be rebreathing a lot of air. It just increases the chance of a spread. And that's important because then we start to spread it and our numbers go up. We potentially get folks exposed that have underlying health conditions. requiring hospitalization, all those factors that everyone has talked about, and we could go backwards. So when we go backwards, it just puts us farther away from that goal of getting completely open. So I think it's important for people to think about that. And as she said, difficult decision. It was very difficult, but we have people on both ends of the spectrum. We hear in the medical community, in the business community, just input from everyone. As you probably see on Facebook, it's on both sides of the spectrum. And we, even within our group, we're in varying different places personally, but we are tasked with doing what we believe is best for Manhattan, Riley County area. And that's what we're doing. And so that's the decisions we made based on all that input.
Thank you for all the hard work that went into that. And I know it's difficult to get a large group of people to agree, and I feel like you found a good middle ground with everything. So I appreciate all the work that went into that. If people are looking for information about how to reopen safely, we've also been working very closely with Manhattan Area Chamber of Commerce and their group called Region Reimagined, which takes, like the title indicates, a regional approach to economic vitality in the Flint Hills area. They've compiled a lot of good information on their website, which is regionreimagined.org. Again, that is regionreimagined.org. You can find published best practices, information about resources for staying safe, and the safety requirements issued by the Riley County Health Department are available there as well. So that is a very good information hub, both for businesses and customers who are looking at the situation and trying to keep themselves, their families, their employees safe through this process. Also looking at kind of the data and what might happen for the future. If we do see an outbreak or a spike either at an individual business or kind of in a larger way for the community, what happens at that point?
Yeah, so we're going to have to assess that individually, of course, depending on the business, how big the business is, how many employees they have. If we see that a lot of employees were in close contact with an employee who tests positive, we may have to consider closing that business, especially if that business is not, if they do not have the best practices in place. So we will look at that individually and determine based on that. But I will reemphasize that we do have a 14-day quarantine for anyone who was in close contact with someone who's tested positive. I'll also reemphasize that anyone who is asymptomatic could still be carrying the virus. We've seen that actually quite a lot in some of our cases. They may not have been showing symptoms, but they're still carrying that virus. So just keep that in mind. You will have to be quarantined for 14 days. That means you will not be able to work if you were in close contact with the person.
Okay, thank you so much. I want to be mindful. We are getting quite a few questions on the Facebook page. The first one I'd like to ask, are elective surgeries, well, we do have information that elective surgeries are going to resume at Via Christi Hospital starting Monday. Can you talk a little bit about that process?
Yes, there are elective surgeries that will resume starting on Monday. Those individuals will need to be tested beforehand. So we will get that done beforehand. That will probably spike our numbers as far as pending tests and hopefully our negative tests as well. So just be aware of that when our numbers start showing a little increase more so than usual next week.
And it's important to note that if we get, just because we have a spike in positives won't necessarily set us back, because we're testing more. And so we know there's a lot more people out there that probably are infected and are asymptomatic or have very minor symptoms. And that's kind of the point for the slow reopening, because as those people start to move around more and socialize and go into restaurants and sit for a longer period of time, they have a better chance of infecting others. And they might infect someone who has an underlying health problem, and then our hospitalization or the criticalness of it goes up. So a spike in numbers doesn't mean we'll go back, but it does if we have a higher spike, a percentage with the negatives and people that require treatment.
And we've seen, based on kind of how the virus behaves in different populations, that younger folks tend to get kind of a less severe case. And and are a little bit more likely to be asymptomatic but still positive. And that's particularly relevant for our area because we do have such a young population here. So the advice is still limit your activity as much as possible, stay home as much as possible, try not to interact with people who are outside of your household. And if you do, take those safety precautions, such as staying 6 feet apart, wearing a face mask, and practicing really good hand hygiene. Washing your hands is still the most effective method if you don't have soap and water available for washing for those 20 seconds. The CDC approved alcohol-based hand sanitizer is still a really good practice, and we're going to be seeing that be required to do that for quite some time in the future. So kind of relating back to a part of that conversation, a question came in regarding whether face masks are recommended or required at this point.
So face masks are not required at this time, but highly recommended. We do recommend most businesses to go ahead and have your employees wear those face masks. I have been seeing a lot of employees wear face masks. I actually went out this morning to the grocery store and all employees were wearing face masks. And actually most of the customers in the store were wearing face masks as well as myself. So it's good that we're all, that's kind of the trend now. Nobody looks silly, everyone's doing it. So please wear those face masks. And that is, again, to protect other people. And I think that's just going to become the trend from here on out. So it is strongly encouraged.
Now, we do have a requirement for restaurant workers, though, isn't that correct? People who are preparing or handling food are required to wear face masks. Can you talk about that just a bit and why the difference?
Yes, sorry. So restaurant workers are required to wear a mask, and that is because they are handling food. They do come in close contact with customers or with each other. So it is required now of restaurant workers, all employees there, to wear a mask.
Okay, thank you so much. I'm scanning through the Facebook questions here. A lot of them, again, related to requirement of masks. I think we've covered that for today.
Vivian, I might hit something on the masks, just the importance of if you're going to wear one, make sure you're wearing it properly. Our last Facebook Live, when we had Bob Koppel on, he did a very good job of explaining the concept of the mask. And so as I was out today, I even thought about taking pictures just as a way of showing, maybe as an infographic on our Facebook Live, of all the different masks that were on wrong. And so it gives you a false sense of security. It's not doing what it should. You know, it needs to be up over the bridge of the nose, underneath the chin, tied up against the face, and then don't be touching and adjusting it. I always find people coming out, pulling it down off, or pulling it down to talk to someone and then putting it back on. All those things are defeating it. And then anything that was on the mask now is on your hands, which is why we've emphasized so much the washing of your hands. That's the primary transfer method. So wash, 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 sanitize, sanitize.
A couple follow-ups to that. We did take a clip of Bob Koppel's advice, just that segment where he walked through the proper use of PPE. That is also available on that regionreimagined.org. That's regionreimagined.org website. And I'm going to go ahead and pin that to the top of the Riley County Health Department's Facebook page. So that'll be easy access anytime anybody needs a refresher course, because he gave us some great information about that. And Kurt, you talked about kind of being out and about. The weather's been really nice this weekend. What are you seeing in terms of kind of compliance for the community? What are people doing?
Really, same song, new day. I was took advantage of the day myself and did some shopping I needed to do this morning. Was out at various stores for gardening, as well as the grocery store. Saw many things that Julie talked about, the number of masks, and really how the businesses that have been open are doing a good job of those best business practices. So those that are opening, look at that and see what they're doing. Those things are working. Then I went home and did a bunch of gardening, but apparently a lot of other people decided to go out to Pillsbury Crossing. So we've had some calls out there, and we're out there. It's not too bad, but it kind of points that it's the stay-at-home order from the governor still in effect until Monday. And then on Monday, it doesn't mean get out there and go do whatever you want. It's still, that's why we called it a restricted movement order. We still want people to be cautious, be wise in what they're doing, not to gather in groups more than 10. While they're out and about, going to the other businesses which are open. And I want to encourage you, go to those other businesses that are opening to help stimulate the economy, our smaller local businesses. But again, don't be in big groups. Those house parties still aren't going to work. We don't want to have the house parties where everybody's congregating together closely, people coming and going. That's how we get the spread. And again, as you have mentioned, we have a younger population, and everyone will notice that a lot of our positives tend to be at a much younger age group. So it's important for people to remember when they're out at the house parties and socializing like that, that they could be asymptomatic and continuing to spread this. And that's going to set us back. So we need to move forward cautiously.
Thanks, Kurt. And just to kind of reemphasize, the limit on gatherings is still 10 people, and that is still an actionable. We try to get voluntary compliance, as Kurt has said, throughout this process. The goal is not to issue tickets, but and having a gathering of more than 10 people is in violation of the order, not just the local order, but the statewide order at this point. I want to address one more question and then probably wrap things up for today. In terms of the number of patients at the hospital, somebody specifically asked on Facebook, I had the misinformation that we don't know how many people are at the hospital. Just to provide a little clarity, I wasn't able to get that information today for the broadcast, but they do share those numbers with us on a daily basis typically. And we are aware of how many people are in the hospital, how many positive patients, how many persons under investigation, which means someone who is suspected to have the coronavirus, but they're pending test results. So we are in constant communication with the hospital, and I apologize for not getting those numbers to the public today, but just wanted to reassure you that we are in communication with them and do have access to that information typically. Any final thoughts as we kind of wrap things up for today?
Just want to remind people, wear your mask when you're out, when you're not able to be 6 feet from another person. And even if you're not sure if it's going to be crowded in that store that you're going into, it's just a good idea to wear that mask. I think, like I said before, it's going to be the new trend. So please wear a mask. Please wash your hands, use hand sanitizer when you can. We really need to be cautious these next 2 weeks going into this kind of reopening phase. We need to be careful about our movement. And like I said, it's not going to be, we won't know for another couple of weeks the effects of this reopening phase. So just please be cautious and have a good rest of the weekend.
And I want to remind people that her order is out on Riley County KS.gov/coronavirus, as well as the Riley County Health Department's website. And I know some people have asked, well, where's the business practices that are required? It's not in the order, and it is. It's just you got to go scroll on down past her signature, and it's on the next page. People should look at that, and I think customers need to look at that so they know what to expect at the businesses they're going to, especially restaurants. They won't be able to wait inside for seating, things like that, so that they'll know what to expect. And again, caution people, let's move forward slowly, and we'll win this race.
And if you have any hesitation about going out, even if you are a business owner and thinking, I don't think I'm quite ready, certainly use your own judgment about whether or not it's time to reopen. This isn't any sort of requirement that you have to be, but just as we slowly move forward, following the guidelines, you do have the option. So we're even hoping that having a few more business options open will reduce crowding in some locations. So there's that positive, hopefully, to look forward to. So thank you again for providing all this information for the public. If you have questions, please email us again at that Riley County COVID-19@gmail.com. That's Riley County COVID-19@gmail.com. Thank you so much and take care.